Leading this session, we are honored to have the president of Ummah Futures International, an esteemed Melissa Institute board director, and a good friend, Wayne Rawlins. You get an idea if you don't know Wayne that he's a known entity and very highly regarded everywhere. The keynote speaker talk about him or mention him. The mayor mentioned him. Nilo mentioned him. So just about everybody who works in our community with gun violence prevention issues, in one way or another, really interacts and is familiar with and is impressed and appropriately kind of like wedded to the work that Wayne is doing. He's a strategic planning consultant who has assisted rural and urban communities nationwide in developing, implementing, and evaluating successful community revitalization strategies. He's the project manager of Miami-Dade County's anti-violence initiative, a 4-year, $7 million strategy that includes group violence intervention, and the nationally acclaimed Walking One Stop, which has shifted the paradigm on how services are delivered to Miami-Dade's most challenged neighborhoods by bringing a one-stop victim service center to the doorstep of residents traumatized by gun violence. He also serves as the director of the South Florida Reentry Task Force. Wayne has developed several nationally recognized initiatives and has been honored with the Director's Community Leadership Award from the Federal Bureau of Investigations in Washington, D.C. He co-authored the Planning for Reentry report, the 2004 South Florida Reentry Summit, which was used by the White House for its Office of National Drug Control Policy grantees across the country as a tool for developing comprehensive multi-agency ex-offender reentry plans. Former Florida Governor Jeff Bush appointed Rawlins to serve on the governor's ex-offender task force, which was the vanguard for unprecedented policy changes in reentry. His work have been highlighted in national and international conferences and publications. And as I said, he's almost in every committee and every group that we had to do with gun violence here in Miami. Thanks, Wayne, for joining us today.
Thank you very much, Itioni. It is certainly an honor and a pleasure to be here today with so many great individuals from not only Miami-Dade County and around the country. And I do also want to express my condolences to Lynn, to Mark, and everyone that's listening that has survived gun violence, either to a loved one or they themselves that have experienced it. And to the Melissa Institute, who has done tremendous work. And I'm always in awe when I sit in on one of our board meetings and see the talent and the commitment and the sincerity and the humbleness of those that participate in the Melissa Institute. So thank you, Itioni, and thank you, Lynn, and the rest of the Melissa Institute family. Well, the anti-violence initiative, it first began in 2008 with the South Florida Anti-Gang Summit, where we brought together 175 experts from around the country and locally to look at some of the emerging gun and gang issues in Miami-Dade County. And from that, there were a number of recommendations to move forward with a operational plan. And the concept was to take the old, some of you may remember the old Weed and Seed initiative, where it was prevention, intervention, community policing, and reentry. And then the Project Safe Neighborhoods initiative came, and instead of using community policing, they used suppression in that component. And so we kind of kept a similar framework. Then in 2019, the Board of County Commissioners instructed the mayor to implement the group violence intervention strategy. And so having already an anti-gang initiative in place to say, well, taking the work of the anti-gang initiative and then fusing it into the group violence intervention program, we came up with the Miami-Dade County Anti-Violence Initiative. In 2021, we looked at some of the hospital-based initiatives that were taking place around the country in Baltimore and Boston, Minneapolis, and elsewhere, and said, you know, this I think would be a really good fit for what we're doing. So instead of providing just straight case management with credible messengers, we decided to hire master's level and higher social workers to be able to provide the case management. And that was really a game changer for us because, as you all know, there are so many clinical issues, medical issues, trauma-informed issues that people experience as a result of gun violence. And having the people that are equipped with the tools to be able to address those from a clinical standpoint was key. But not only were the ones that we hired capable with master's levels and PhD level degrees in social work, they were also credible messengers. They were young women, you know, that came right from the neighborhoods that we serve and have experienced gun violence themselves and experienced the challenges of the populations that we serve. And so they not only came in with the knowledge at a master's level or higher, but they also came with that lived experience, which is not something that, you know, you can learn in the classroom. So they come with a level of empathy and sincerity to the work. So that was really critical for us to make sure that we had the right people doing the right job. Prevention, it's funny, we looked at prevention from really gestation and say, how can we avoid that whole school to prison pipeline? And so we started out with a very simple initiative called Hotspots Freedom. And in addition to that, we wanted to educate the broader community on what gangs, what's the composition of gangs, how to prevent it, how to intervene if your child is already gang involved or group involved. We say group involved because gangs, they very often are affiliated with Bloods and Crips and Latin Kings and all that, and groups could be anything from, 3, guys on a block that are trying to control whatever it is that they're trying to control. And then we've introduced Resource Writer Community, and this is an amazing technology that helps us to get ahead of the violence. And fortunately, we are the only ones in right now in the world that have this on a community violence intervention pilot that we're doing. So the Hotspots reading, what we do is we look at the child care centers, daycare centers that are in the areas that have experienced recent or persistent incidents of gun violence. And then we dispatch our staff, criminal justice professionals, into those centers. Criminal justice professionals are particularly interesting as it relates to this because prosecutors and police that go in and reach the children are seen in a very different light than in the communities that these daycare centers are typically placed. So, for example, when a police officer comes into one of the neighborhoods that we serve all too often, it's not a good day for somebody. Somebody's going to jail, or someone's got shot, or something bad happened, and the police are there. And so to see a police officer come in uniform to a daycare center and read to the child and provide an opportunity for them to get a in the book club with the Children's Trust, our local Children's Services Council, that child is now seeing that police officer not as the enforcer or the enemy, but as officer friendly. And that book that is now delivered to that child's household helps them to start to build their own home library, and hopefully that there's someone at that home that will read to them, because you and I are readers today because somebody invested time to read to us, right? And unfortunately, in many of the households that we serve, the literacy rate is quite low, not 100% of the time, but generally speaking. And then the children will enter into grade school already with a 2,000-word vocabulary less than children from the more affluent neighborhoods, and it's very, very hard for them to compete. So a very simple initiative, but very impactful, a hotspots reading program. It establishes this appetite for learning, an appetite for reading in the children also. And it not only does it help the children, but it helps those that we dispatch to the daycare centers, because it makes that connection to the children that are coming from the neighborhoods where there is a lot of gun violence. So very simple, very basic, but very powerful initiative. Gang awareness presentations. It's pretty self-explanatory. Try and address the warning signs, what to do if those warning signs are apparent, and then if the person is already deep involved into gangs or groups, what to do to intervene. We most recently added our medical director to the team that delivers the gang awareness presentation, and Dr. Evelyn as well. She is a trauma surgeon at the Ryder Trauma Center. And so she goes in and talks to the children, and their eyes get very wide. And so it's exciting to have our medical director to participate in those gang awareness sessions. And the questions that the children ask are very enlightening as well. And in fact, we just did a session a week ago at the Coconut Grove Optimist Club. And sadly, 2 of the children have lost their fathers to gun violence. So we are going to be going back to that group to provide additional supports and training for those children that have been adversely affected by gun violence. These resource router community. Sound Thinking, what they did is they took 5 years of ShotSpotter data, 5 years of Part 1 crime data, environmental data, like where the liquor stores are, the full moon, phases of the moon, and all kind of interesting data. And what happens now for us is, instead of our violence interrupters only mobilizing when there's an incident, or only doing canvassing in areas where there are incidents, utilizing AI, we can now get ahead of the incidents and project where the next incident might take place based on the ShotSpotter data, the Part 1 crime data, and environmental data. So our violence interrupters, they have a smart device that shows them where are the areas to canvass in advance of a shooting. So their time is not spent just waiting for another incident to take place or following up on an incident that recently took place, but now getting ahead of the incidents and preventing them from happening in the first place. So we're very excited about that. We're piloting it with Sound Thinking, and we're the first in the world to do that. So we're very excited about that aspect of the work. Then, the second component, intervention. We work very collaboratively with police and prosecutors. We don't think that this work can be done without law enforcement professionals. They are a part of the community, just like you and I, and it is I think, foolhardy to think that you can do this work without the engagement of the criminal justice community. And so one of the things that we have done, and this was in response to the 2008 South Florida Anti-Gang Summit, one of the objectives was, let's put one-stop social, economic, and health-related service centers in all the areas where the high incidence of gun violence. Well, 2008, let's roll the clock back, and what happened? There was the housing bust, so there was no money for this bricks and mortar and staffing and, you know, equipping these one-stop centers. And even if you did, okay, let's say if you were able to impact one area with this one-stop center, now you've got this center just stuck there, and, you know, crime very often can be displaced into other areas. But now you've already, you know, made all this investment. So by the grace of the Almighty, we said, well, why don't we put that one-stop center on the shoulders of criminal justice professionals, social workers, community activists, elected officials, and bring that one-stop center right to the doorstep of the people in areas where there have been recent or persistent incidents of gun violence. And we came up with the idea of the walking one-stop. So the one-stop we were able to bring to neighborhoods where there were incidents and bring the services right to the doorstep. And the impact is so powerful, not only for the residents, but also for the social workers that go out that and criminal justice professionals that go out, because let's face it, most of you on this call, you became social workers or got involved with this work because you really believed that you could change the world. And what happened? You got stuck in a cubicle doing case notes piled up to here. So this got you, walking one stop, get you back out right in the neighborhood where you can see what's going on, smell what's going on. It's amazing the impact that you have not only on yourself as a professional, but also on the residents in the community, because it's not just the victim or the survivor that's impacted by the gun violence, but what about the neighbor? What about the one that lives across the street? One that lives in the natural boundaries of that community that have been equally affected by the violence? So this walking one stop, we bring set up a staging area. We can deliver services right on the spot. If services are not available for what the resident needs, we'll make a referral and ask those agencies to follow up with us within a week as to the success or the lack thereof of delivering that service to the resident. Very, very powerful, and we've done about 300 of them, and we've never had a problem, and it's been quite successful. Positive peer leadership mentoring. We have done positive peer leadership mentoring with children as well as adults. We started out at the Indian River Correctional Institution, where all the children that were direct filed in the state of Florida were held. And we were told that all they deal with every day is gang violence in the prison. And so, and these are children that, you know, are under the age of 19 and are serving adult sentences. And so just imagine if you put children from Liberty City and children from the tough places in Orlando, in Jacksonville, and you put them all in one place, you know, it's just like, it's an accident waiting to happen. And so once we started positive peer leadership mentoring, we were told that there was not any serious, and no more serious violent incidents in the prison. That prison later closed for downsizing, and we have been working in the Everglades Correctional Institution with mostly men that are serving life as for murder, and that prison has now changed from being a very, very tough prison to an incentivized prison, where they have very few problems compared to what it was when we first started positive peer leadership mentoring. And then we also do it with children and in the neighborhood of the Verde Gardens community, where children have transitioned from living in shelters and being homeless to transitional living. So it's an opportunity for the individuals that you are hoping to impact with your work, for them to build out plans to improve the quality of life of where they live, and then help them to execute those plans. And then hospital-based violence intervention program, of course, most of you have heard of it. in one city or another. Here it's very different. I already mentioned earlier that we utilize social workers that are master's level and higher. We have a data coordinator based at the trauma center, and we have a medical director, Dr. Valenzuela, who goes out in the community. She goes out on walk and one stop. She goes out on gang awareness presentations. She goes out on hotspots reading. So it is totally transformative for the those that are delivering the services, as well as those that we are serving. We emphasize a lot on relocation. We have moved people out of state to Texas, to Virginia, you name it. Just get them out of harm's way here in Miami-Dade County if they were victimized, or if they are likely to retaliate. Get them out of the area so they do not retaliate, and have an opportunity to cool things down so that they can think straight. Victim services on the state level move very slowly in terms of relocation, where you have to file with the state, the attorney general at the state, and just it's a very lengthy process. And between the time of filing and the time of approving, a person could be murdered or murder someone. We can move someone in 20 minutes. So if a person is in harm's way and the police agree that they should be relocated, because some of them have legal exposures that would prohibit us from relocating them. But if they don't, we can get them out in 20 minutes to a safe space from the time that we are notified. Suppression, we look at suppression not in a non-traditional sense. It's a group violence intervention. Group violence intervention is a framework that was established originally in Boston with the criminologist David Kennedy and others. And we've been very fortunate to be one of the GVI sites around the nation. And the hallmark for our work is what we call custom notifications, where if a person has been shot or is a likely shooter based on the data, we will give them a custom notification. It's messaging that tells them, look, we want to see you safe, alive, and free. Don't shoot anybody. You know, and what do you need for help? It could be social, it could be economic, it could be health-related help. We will, for example, a person from one of our catchment areas is shot. They get patched up at the trauma center and they're sent home. They may not have a clue what to do in terms of their discharge plan. They may not have read the discharge notes. They may not know who their primary physician is. They may be oozing at the wound and not know what to do with it. Well, we have a registered nurse, master's level registered nurse, Cleveland, young, Black, male, that will go out and visit them. And he will teach them wound care. He will teach them nutrition. He will teach them how to navigate the healthcare system so that they can get the follow-up treatment so they don't get infected or able to access physical therapy that they may need to relocate. So it has been fabulous. I mean, to have a trauma surgeon, to have a registered nurse, to have master's level and high social workers on the team, it's really given the people what they need from a trauma-informed way, and it's been extraordinary in our initiative. Call-in is something that is a part of the GVI where it's kind of like the custom notification, but we bring groups in. It's been problematic for us, and because the call-in requires the willingness and the volunteering of known group members to show up at a facility for this call-in meeting. So that some of you may know that if a probationer it does not have something in the judge's orders, they don't have to comply, and they don't. So we'll invite 100 people to a call-in, and if we get 5, we're very, very happy. And we're like on pins and needles right up until the start of the call and hoping that they show up. So we really rely on the custom notifications more than the call-in. But maybe if you're in another state, maybe the regulations as it relates to probationers may be different, and call-in can be a very effective tool, and it actually has been for us when we've done it, but it's just not easy because of our probation laws, rules. Custom notifications, I mentioned that. We do that with the police, and it's very impactful as well. And all these things that I'm mentioning, we've had site visits from Copenhagen, Memphis, Nashville, Philadelphia, Columbus, Ohio. We have in a couple of weeks coming in, Harrisburg, Pennsylvania, Chicago. You're welcome to come visit us, and we'll be more than happy to show you firsthand all these aspects of our work. Street outreach team, they are credible messengers, violence interrupters. I'm quite sure everybody on this call is familiar with violence interrupters that will go out and engage on a street level to support individuals with services. Also, we never have them engage with police on the street, but behind the scenes, we have a very robust shooting analysis that involves police, as well as our street outreach team, our social workers, you name it. Everybody that has some vested interest in the safety of the community is a part, and street outreach is really just front and center in that, because they understand the street dynamics better than most. So street outreach is critical. And here we have a group called Circle of Brotherhood that are our street outreach team. And reentry. Finally, this is our last component. Reentry. We spend times in the jails, in the prisons, working with individuals that are soon to be released, and connect them to social, economic, health-related services so that they can be successful with their reentry. We also deliver the GVI message, during the reentry fear. We want to see you safe, alive, and free. Don't go back to, whatever got you here in the first place. And so we'll bring in the social workers, we'll bring in service providers, housing, probation officers, everybody that can have a positive or negative impact, I guess in some cases, on their reentry. That we bring them in and get them prepared for that first day out and the subsequent days of their release. And so it's very powerful. We've been doing those reentry fairs since 2004, and it's a very powerful event, and kind of a handoff from the corrections department to the community, saying, "Here, we welcome you home. Here are the supports that you need to be successful." We have a resource guide that we produce in partnership with the U.S. Attorney's Office, as well as a plethora of providers that have services geared for reentry. And this year, we have taken that guide and made it into an app. And you can view that app at flreentry.org. And it not only does it have all of the resources of the, I think we actually have a mistake on there. I'm sorry, where it says the URL, it should be 2 E's. So please forgive me for that. It should be FLREENTRY.org, where you can access all these resources that are on the guide. Plus, there's a back office with affirmations, to-do lists, planning tools, and all of that. And it's always stays fresh, because the printed guide gets old very quickly. Citations that reinforce the empirical value of our work, and contact information.